We're recording.
Okay.
Hello, this is Judith Fulton. I'm here with Ms.
Beverly
Beverly
Brock.
and we are students in Nursing 650 with Dr. Carter as a professor, and we'll be discussing curriculum design, structure, delivery methods, and program model for the second week XP activity. Our first question is, what type of curriculum design would you like? Concept-based, illness-based, or other, and why?
We chose concept-based because we would incorporate different concepts into learning. And one of Judith and I's favorite concepts that we have kind of undertaken, we both have an area that we enjoy: simulation. And I think using simulation as one of the concepts, it will also integrate learning and have a smooth transition for the students as they transition into their practice.
Yes.
In the clinical environment.
Yes. And what delivery method, and you touched on that, best fits with our philosophy, framework, and design. And we had the options of online, blended, and traditional.
And we chose the blended one. We can use the computer concept as far as the simulation. It would be done by a computer generated mannequin, and we would do traditional as well, integrated into the conceptual framework.
And one of the things I love that you talked about, Beverly, when we were discussing as we've been working on this, is that nurses need both. You know, the new millennium nurses, they're computer savvy, and that's where the future is. So we have to incorporate that. But we also still have to have traditional nurses have to put their hands on the patient. They have to go in and take the blood pressure. They have to have that live clinical experience, even some of that didactic, especially the BSc and the new pre-licensure. And if they're coming, as we're talking about accelerated program, they're coming from different backgrounds. So they have to understand that underlying part that they might miss if they don't have that that traditional part to go along with the online or computer based.
Yeah, we still have to have that old time manual blood pressure cuff and their basic skills, and incorporate the bedpan and all those necessary things, because just because they are going to be BSN nurses, they still have to have a certain level of skills.
Exactly. We agree so well. Next one, what student learning outcomes are we considering? And we've talked at length, and I know we've done a lot of research, and we've looked at different facilities trying to find something that was similar to our goals, and you found a very good one. You want to share that?
Yeah, that one that I found was with the Denver School of Nursing. And I kind of adapted their concept and kind of followed their guideline as far as creating our curriculum. And their student learning outcomes, they said upon completion, the student should be prepared to provide direct and indirect care to individuals, family groups, communities, and the population. Design, manage, and coordinate nursing care. And they have best practice on current knowledge, theory, and research. And you know, we love research because we got to always have that evidence. Assume responsibility and accountability for practice. Form partnerships with patients, families, and other healthcare professionals. And here's the big thing that we all have to incorporate in learning: demonstrate critical thinking skills in the delivery of care. And I think with Judith and I, as we talk about the simulation, I think we can both agree that simulation will enhance the critical thinking skills, because they can see the simulation over and over again, where in the patient care setting, when they're doing the clinical, the episode may only happen once.
And like we discussed, it's going to fill that gap too. Especially with the students that have previous experience and degrees. It's going to be important for them to be able, in a safe environment, be able to try those skills, test them out, and see the mannequin die. And not necessarily the patient that has experience, in a safe zone, So that was one of the big things, like you said, we agree on. The other one, research.
Yep.
Research. Because for us to move forward as a profession, like you said, we agreed on it, that we have to have that research. We have to have that foundation and be the why we're doing it.
Mm-hmm.
We had history back was in 1985. We talked about that in other classes, how there were so many deaths or near misses and all those other things that it became necessary to revamp, and the state was calling for it, the nation, that we had to prove and not just go out there on a whim and do things. By having valid research, it just strengthens anything that we do. And so we can call back on that and just not make assumptions. So that was an important thing we've talked about. Let me see. We're going through this pretty quickly. We were in agreement on so many things. Let's see. And we did say the outcomes were per the NCLEX and Bloom's taxonomy or application level.
And apply their knowledge to the questions. If they're asked a question based on an event happening, that they can apply their critical thinking skills, what's happening in the scenario.
Okay. And what is the difference between a student learning outcome and a competency statement? And then when we finish, I'll repeat, how will you use each of these in our program?
Well, we looked at how we wanted the student learning, and if we get the students to learn what we have as far as our curriculum goes, when we do our outcomes based on that, the students should be able to perform at the level as we designate. I can't even talk excuse me, y'all. As we designate our outcomes for the program and the competency level that they should acquire. If we teach based on what we have outlined the program as, everyone should come out basically pretty knowledgeable. To be able to acquire the knowledge. That may be a better word.
And like we were discussing when we were prepping, we were saying that at the competency statement is that, as you said, they'll be able to do the skills and behaviors. But our learning outcomes even supersede that. We want them to be able to do the behaviors, but we want them, as you said, to be able to advance, be able to critically think, be able to tie it all together and not just do the pieces and parts. So our outcome goals even supersede, like you say, the typical competency level. We want them to be, a functioning, positive, strong force in healthcare, not just at the moment, or their facility, but I always laugh in the political arena, in the nursing office, in the boardroom. That's our goal, their outcomes, that all of these skills will prepare them for that. Anything else you think we need to add, or thoughts about our program and design?
I think upon completion of our curriculum, that we also discussed that our nurses would be competent, that we did prepare our program to apply for accreditation, and we were going to use the CUSN competencies as a guideline for our program for our learners, because we also plan to have, it's not a bridge program, but the RN, the associate degree nurse, could also attend our program to acquire a BSN. And we want to make sure that they'll all come in, as you just said, at different education levels and coming from different educational backgrounds. We want to make sure that they are all at the standard based on the North Carolina Board of Nursing standards of practice.
And something you mentioned earlier, and I really liked the fact that the other facility we compare ours to, when we did the evidence-based research you were completing, that Houston, as you said, even with the school, that's one of the accreditation, because our goal is to be accredited, and that's one of the ones that is often well thought of and respected. So we want to follow a system of what's been proven. We're doing evidence-based preparation of our school. So I think for the presentation, this is what we needed. Is there anything else you want to add, or you ready to close out?
Yep.
Okay. Thank you so much for all the work you've done to prep for this and a smooth transition. I'm glad we have very similar mindsets. And I guess that's important when a team is working together for a curriculum.
Okay.
Okay. Talk to you later.
Okay.